My name is Dimitrios Athanasiadis. I'm one of the residents with Indiana University, and I wanted to thank SAGES for the opportunity to present the work of our department, which is about social support provided to bariatric surgery patients through a Facebook group. I have nothing to disclose. So as we already know, obesity is an epidemic in the United States, and actually 1 in 4 patients in the future by 2030 is going to be a candidate for bariatric surgery. Bariatric surgery is the most durable option as well for weight loss, but it has variable outcomes, and one of those is the social support that our patients have. Social support is has many multifactorial. Someone would say family, friends, community. Sometimes it's changing on its own. Okay. Since research has shown that the social support actually improves outcomes, ASMBS has made a requirement for the accredited centers to have frequent social support group gatherings. Those in-person, gatherings that are mandated make it difficult for patients to attend sometimes, and time is one of the issues that we found is preventing them to join those meetings, scheduling issues, or the distance, and sometimes those patients have mobility issues as well. On the other hand, there are many groups online. I don't know. I didn't know about their existence, but there are many online groups, like in Facebook or other online sites, that a patient can join and have some discuss matters about bariatric surgery with other patients who had the surgery before. But this is questionable because they're not being monitored. Thus, we have created in 2015 a Facebook group that's administered by our own bariatric providers, and our patients can have social support through that group, but at the same time, the quality of the conversations are higher, and we can actually help answer some of their questions. So the aim, though, was, is this a group actually helping our patients? Is it improving their outcomes, and especially the weight loss outcomes? So for the methods, we surveyed our patients who are in this group about how much they're using the Facebook group, and then according to that, we split them into different groups. I'm going to show you later. And then we recorded some of their baseline data as well, like age, sex, insurance, preoperative weight loss as well. Type of procedure, hospital stay, and complications. So we had 2 basically groups from that: the frequent users who are using it at least once a week, and the non-frequent users. And then we had a control who never had actually a Facebook profile, and thus were not included in this group. So we had about 200 frequent users, 55 infrequent users, and then a control group from the same period of time. And as you can see, there was a difference in the gender, but that was the only baseline characteristic difference. And then we found that the early weight loss, 6 months, first year, and second year, was superior in the frequent user group. So as a conclusion, a frequent participation in Facebook support group can lead to improved weight loss outcomes, at least in the early post-op period. If additional long-term studies confirm our findings, this is an important addition to any bariatric clinic, especially during times of social isolation that the in-person groups may not be able to take place. And as future goal, and this was the limitation of our study, was to record the social support baseline of our patients so we can adjust for it as a confounder. Thank you very much, and I'm happy to take any questions.